Hi, so today I'm going to be talking about heart disease and hormones, which is a really big topic, but I will try and condense as much as possible in half an hour. It's really important that we think about our hormones, like I said before. So our sex hormones, which shouldn't really be called sex hormones, but anyhow, estrogen, progesterone and testosterone, because they get into every single cell in our body, as I've said before. But it's our heart system that's really, really important. And there's actually more evidence regarding estrogen, so oestrodiol in our heart system, and that's what I'm going to focus on for the next half an hour or so. Now, our heart obviously pumps on average 70 times a minute. So it's a really important, really strong muscle that actually is controlled by our brain. So our heart rhythm and rate is controlled by our brain, but also by conductive pathways in the heart as well. So the heart is an active muscle tissue, and the blood supply to the heart is really important because obviously when our blood feeds an organ, it gives it oxygen, it gives it nutrients, so it works properly. So our heart is a pump of muscle, same as other muscles, but it's involuntary in that we can't control so easily. I can move my arm, but I'm not thinking about my heart beating. It happens obviously all the time. Now, when we talk about cardiovascular system, cardio is the heart, of course. The vascular is the blood vessel system. Now, we've got blood vessels all around our body because that's how all the nutrients and oxygen, all the goodness goes to every cell. And then we've got our venous system, which drains away all the sort of badness, if you like, but also, so it sort of drains away from all the cells. So the cardiovascular system is very dynamic. It's not something that's fixed. So in the lining of all our blood vessels in our arteries, we've got something called the endothelium. And I'm telling you this because this is important when we think about how estrogen affects our cardiovascular system. So the endothelium is the lining of the blood vessels, especially when we're thinking about the arteries, which are the arteries go away from the heart. They pump the blood away, or the heart pumps the blood away from the heart around the body into all our tissues in arteries. Then they get smaller to arterioles, and then they get smaller and smaller to capillaries, and then we've got this venous system that drains everything away. Our blood bodies really are fascinating, and for many of you that know, I did a pathology degree as well as a medicine degree, so I'm very interested in the way our bodies work, because when we know how they work, it's easier then to understand how they don't work. Now, as many of you know, I wasn't given any training about the menopause when I was a medical student in the 80s and early 90s. But I do remember very clearly a lecturer, and I remember him, he had a red hoodie on, we had the acetates where people would write down, we had no PowerPoints, we had no internet, because I'm quite old, and people would just write things down and project it on a big screen. We were in a big lecture theatre, there were 200 or 300 of us in a lecture theatre. And this man was talking about heart disease, talking about how to recognise someone who was having a heart attack. And he said, women are protected from heart disease when they're younger. And then when they get over the age of 50, their body changes and they have an increased risk of heart disease. But we're not really sure why. And that sentence has really stood by me, and it's made me think and reflect, and I'm quite an inquisitive person. When someone tells me something at face value, I want to know why. I'm like that really annoying 2-year-old, just asking why all the time. And that is important with medicine because we're always thinking and learning, and it's important as clinicians we have quite inquisitive minds so we can advance the way we think, which is obviously going to then help our patients. So I've been thinking obviously a lot since that time, and of course what happens is that it's because there's a drop of our hormones. And now what I want to do is spend some time thinking about how the hormones work in our body, our natural hormones when we have them. So this isn't about HRT, this is about our natural hormones, but especially estrogen. So estrogen works in many ways throughout our cardiovascular system. But it's the lining of our blood vessels that needs to be as healthy as possible, because you can imagine Once our arteries get furred up with atheroma fatty deposits, then there's less space for the blood to flow through. And this is what happens in atheroma and atherosclerosis, is that as people age, as there's more inflammation in the body, as cholesterol, bad cholesterol increases, you get this build-up of this sort of fatty plaque, atheroma, the narrowing of the arteries occurs, and then especially if these are arteries feeding our blood, feeding our heart, if they become very narrowed with a blockage and then suddenly there's a little clot, then it blocks off completely, and that's why people have a heart attack, because the blood, the oxygenated blood in the arteries, isn't getting to the cardiac muscle, which is called the myocardium. So the lining of the blood vessels, the healthier it is, the more open our blood vessels are, the lower the risk of disease and heart attacks is, which is really important. Now I've got a picture here, I've got a few things here to show you, but I don't know how easy it's going to come over on the phone. But this is a picture of if I've got a blood vessel and I've cut it out and got a little bit, so I'm looking up inside, and there's various things that are marked here, but actually what we've got lining our blood vessels are some smooth muscles, so some muscle, because that gives the tone to our blood vessels. And then we've got this endothelium, this lining of the blood vessels, and the cells are very active and they respond to different things. So obviously we want any inflammation to be reduced to keep the lining of the blood vessels open, and there are different chemicals that these cells produce. So we call them cytokines, which basically means a chemical from a cell. So if you've got anti-inflammatory cytokines, what they do is they reduce inflammation, they reduce any of this build-up that's going to happen, but they also help the smooth muscle to work. Now, if your smooth muscle is relaxed, you're not going to have raised blood pressure in the same way that if it's all tense, as you can imagine. But they also help reduce or they change the level of something called nitric oxide. Now, nitric oxide is a chemical, we have it in our bodies, and it's a vasodilatator, so it opens up blood vessels and relaxes it, and is very anti-inflammatory. So estrogen works to increase nitric oxide. It reduces some of the inflammation, so you don't get this build-up of the lining of the in the lining of the blood vessels, the endothelium. And it also helps keep the blood not so sticky. It changes the way our platelets work in our blood. If our blood is less sticky, it's less likely to clot. So if there is some narrowing, you're less likely to get a clot, causing a heart attack. So all that's really important. Also, it helps to reduce our bad cholesterol as well. So estrogen works in lots and lots of ways in our endothelium, the lining of our blood vessel. Now, we also know that raised blood pressure, hypertension, is a really common risk factor for cardiovascular disease. And we know that as we age, it's just something that happens as our blood pressure rises. Now, many people don't get symptoms when they have raised blood pressure. Sometimes people can feel a bit more tired or have a headache. And obviously, whenever you go to a doctor, they always do your blood pressure, don't they? And we do that because we want to screen for raised blood pressure. Because we know from studies that if we lower blood pressure, it reduces the risk of a heart attack more effectively in men than women. And actually, there are various drug treatments that are more resistant in women as we get older. And again, I've been thinking, why is that? What's different between men and women as we age? Well, often it is related to not having our hormones, because when we look at the way that estrogen regulates our blood pressure, there's many ways. And I've got another picture here for you. I'm going to put my glasses on so I can see it too. This is a great picture actually, because it's got a picture of a man and a woman on it. And so, did you know that men have estrogen too? And actually, postmenopausal women who don't take HRT have less estrogen in their body than men. So we're all made from, we've got the same cells, we've got the same hormones in our body, we just have different amounts. So men have estrogen too. It's not been researched at all, and once men realise that, maybe they might fund some more research in estrogen in men and women. Wouldn't that be nice? Anyhow, this looks at raised blood pressure. So it's got hypertension at the top here, and it's got this circle of all the different ways, and estrogen is in the middle. So if just explain to you, it talks about endothelial dysfunction. So that's the endothelium not working properly, which is I've just explained. It also has got here body mass, so that's the weight. So we know that estrogen helps reduce fat. So as I've said before, people tend to put on weight during the menopause because they don't have the estrogen in the body, and the body makes estrogen in fat cells to try and replace the missing estrogen. But it's not the same as the nice estradiol. It's this estrone, which is an inflammatory estrogen. Now, it also causes inflammation. It also changes the sensitivity to salt, actually. And it also says here something called RAS, R-A-A-S, which stands for renin-angiotensin aldosterone system. Quite a mouthful, but this is actually really important because our bodies are just so clever. When we think about blood pressure, we need to have some blood pressure, otherwise we'd be fainting all the time. So if I stand up quickly, if I move my head, my body has to regulate where it is, and when it stands up, it's got to increase my blood pressure a bit, otherwise I won't get blood going to my brain. So we have these regulators that sense where a position of how we are, and that affects the tone in every single blood vessel. And this renin-angiotensin aldosterone system also works with our kidneys because it affects the amount of salt we have in our blood as well, and our kidneys regulate the amount of salt that we have in our body. So our heart and our blood vessels and our kidneys work really, really closely together through this system. Now, estrogen has a very important effect on this system. And it's interesting actually because when you think about one of the symptoms of the menopause, often people feel lightheaded. People can feel quite woozy, especially when they stand up. They can also get some fluid retention as well. And a lot of this can be related to the way that estrogen or lack of estrogen has a negative effect on our renin-angiotensin aldosterone system, or RAS for short. So it is very important. I also found this other paper, which actually is very complicated. I'll put it on my Instagram sometime, but it also talks about the way estrogen works throughout our cardiovascular system. So I'm just going to read some of this here because it is important. So it talks about inflammatory mediators, so about inflammation, which I've mentioned. Talks about vasodilation, so opening up our blood vessels, helping them to relax, which helps lower blood pressure. Talks about the nitric oxide, which I've explained before, and prostaglandins, which affect the tone of our cells. It also talks about how our kidneys work, so glomerular and mesangial cell growth, which are the cells in our kidneys, which are really important. And we know that menopausal women without their hormones have a higher risk of kidney disease, which is very, very important as well. It also affects some genes. Estrogen affects some genes in our heart as well. So we've got this natriuretic peptide levels, which again help the sort of retention of fluid in our bodies. And there's also, it's got endothelium regulation, so the way the lining of our blood vessels work as well. Also affects it says got here renal vasodilatation, so that's the in the kidneys, how our blood supply through our kidneys is working as well, really important. And also it talks about sympathetic activation and vagal tone. So this is our what's called baroreflexes, how we feel when we move, and looking at the vagus nerve, a lot of you might have heard of, a really important nerve affecting the way that we breathe, our parasympathetic system as well as our sympathetic system as well. And it also talks about our fat distribution, which I've mentioned before in a previous podcast and a bit earlier just now, and also about the adipokine levels, which are the sort of the cytokines, the chemicals that come from fat cells as well. Our estrogen regulates it. So I'm hoping, what I'm trying to show to you, that estrogen is a really powerful regulator of the way that our body works, but especially when we're thinking about our cardiovascular system. If we understand that, and I know that's quite complicated, especially on a Sunday, and I've tried to make it as simple as possible, but if we understand how estrogen, especially estradiol, which comes from our ovaries, it comes from our brain, it comes from various other organs in our body, if we understand how biologically active it is in our body and how important it is for regulating our lining of our blood vessels, our blood pressure and our heart, then we can quite quickly understand why having low levels of estrogen can have a detrimental effect on our heart. And this is important because heart disease is very common. It's actually still #1 killer globally of women and men actually. And in the US, there's 1 death due to heart disease apparently every 80 seconds. We're a bit better in the UK. I think it's about every 3 minutes, but it's still very, very common. So cardiovascular diseases include heart attacks, include heart failure, and actually there are other heart diseases including arrhythmias, so abnormal heart rhythms. You might have heard of atrial fibrillation, when people get an irregular pulse, and if the heart isn't beating in a regular way, then it's not so effective. You can imagine if it's going a bit chaotically, the blood just spurts out rather than coming out properly, so then it means that people don't have the same circulation and people can get symptoms from that. There's also peripheral vascular disease, which is often when there's disease in the arteries feeding the feet and the legs, so people can get ulcers, people can get claudication where they get pain in their calves where they're walking. All of this is part of cardiovascular disease. We also know as we age, we have an increased incidence of having high cholesterol. Now with cholesterol, there's good and bad cholesterol, so it can be quite confusing, but we have this LDL, which is low density lipoprotein cholesterol, which has been associated with an increased risk of heart disease. Now the menopause is a cardiometabolic problem, which means that our heart is affected with low estrogen, but also our metabolism, as I've said before, is affected. And that means that we tend to put on weight, but also we tend to raise our cholesterol as we become menopausal, when we don't have the protective effects of estradiol. So it can be very common to see women whose HDL cholesterol actually reduces, which is a good cholesterol, and the LDL, the bad cholesterol, increases when people are menopausal without their estrogen. And that's another reason why people can have an increased risk of heart disease. We also know from many studies actually, when people are young, so under the age of 40, and have an early menopause, the longer they are without estrogen, the greater the risk of heart disease. But also there's an increased risk of atrial fibrillation the younger a woman is when she's menopausal, and also heart failure as well. So heart failure is when the pumping of the heart doesn't work as well, so the heart becomes weaker. If the heart's weaker, it often can't push the blood around the body in the same way, and so people can get more short of breath. It can back up on the right side of the heart, so people can get swelling of the ankles as well, can cause all sorts of problems. And so we know this from studies. So I know this isn't good news, but this is just fact. I'm not making anything up. We know that when people are menopausal, there's an increased risk of heart attacks, there's an increased risk of raised blood pressure that can be resistant to some treatments, there's an increased incidence of heart failure, atrial fibrillation, raised cholesterol as well. And that's all because, like I've tried to explain, estrogen is very protective on our cardiovascular system. It's really important. It works at a cellular level, and it works on the blood vessels and the heart all together. And because it circulates in our body, it's very important. Obviously, there are other hormones that regulate our heart function and look at our endothelium as well. But this is just one hormone that has been just neglected for years because people don't really understand, or they really probably haven't bothered to understand, the importance of estradiol. So all this that I'm talking about is just the estradiol that we produce when we're younger. And we're lucky because we have more estradiol than men, and we have it in our bodies at a higher level than men until we become menopausal. But once we become menopausal, if we don't take HRT, our levels of estrogen decline, and that's why there's an increased incidence of cardiovascular disease in women in their 50s. And what's interesting and not so great for women actually is that we know when women do have a heart attack when they're menopausal, their prognosis, so their outlook, is worse than men. And partly that's because often women don't have the classic central crossing chest pain with pain radiating down the arm or up to the left side of the jaw. They can present in different ways. They don't always have to have chest pain. So often the diagnosis is delayed. And we know that sometimes they don't respond to treatment in the same way, and there's a delay in diagnosis, meaning that the outlook is worse for women. So anything we can do to protect our hearts is really important. And of course, there's lots of ways we can protect our heart. We know that eating the right diet's really important, trying not to be overweight, exercising regularly, sleeping well, looking at our stress levels, all of that is really, really crucially important. But we can't replace our missing hormone. And that's why it's so important that we look at, does HRT reduce the risk of cardiovascular disease or not? And there's a massive debate. And when you look at top line levels, especially of some of the guidelines, it will say there isn't evidence. But actually there is evidence, and I'm going to show you some. There's a really good paper actually, and this was from many years ago. This is from the Cochrane Library. So the Cochrane Database of Systematic Reviews, which is a really important publication. Now, it came out many years ago in 2015, so 8 years ago now, and I remember reading it and read the top line. And if you read the sort of the author's conclusions here, it basically says that evidence with HRT in postmenopausal women for either primary or secondary prevention, so that means stopping a heart attack, or secondary is stopping a heart attack in someone who's had a heart attack before. So it says there's strong evidence that treatment with HRT has little, if any, benefit for reducing the risk of cardiovascular disease. So if you read that, you think, oh right, it's no good. But then actually, if you read the actual results, they looked at people in different groups. So it said those who started hormone therapy, so HRT, less than 10 years after their menopause, which is when most people start it, so within 10 years of the period stopping, so generally under the age of 60, they had a lower mortality, so the risk reduction was 0.70. So they were 70% less likely to have a heart attack than people not taking HRT. And the coronary heart disease death was actually, the risk reduction was 0.52. So 50% less likely to have death from heart disease in women who started HRT at a younger age. And then they said there wasn't any evidence that starting at more than 10 years, it didn't have, it said it had little effect on death in these women. So actually, this is where looking at the original papers rather than the highlight, if you like, is really, really crucial, because what they've done in the conclusion is grouped everyone together. But we're all individuals. We're all different. Of course we are. But if women start HRT within 10 years of their menopause, then they do have a really significant, actually, reduced incidence of cardiovascular disease, and actually more important, reduced about half risk of cardiovascular disease death. So that came out many years ago, but it was sort of neglected because of this conclusion that people went to. So there have been other studies since, and I'm going to explain a bit more about this difference between 10 years and after 10 years. This is another paper, and I will drip feed them onto my Instagram over the next few weeks because it's Heart Health Month in February, as you know. This is written by a really great person called John Stevenson, and also Howard Hodis and Roger Lobo, who are wonderful people. And it's called Back to the Future, HRT as part of a prevention strategy for women at the onset of the menopause. This was written in 2016. It's one of the first heart disease papers that I read many years ago. And it just blew my brains because I was really felt robbed that no one had told me this before. And it goes through all the evidence, all the studies in a very easy way to understand. It's written in a beautiful way. And it does say, actually on their conclusion, we discuss the findings and put into perspective the potential risks of treatment and suggest we may have come a full circle regarding the use of HRT. In doing so, we propose that HRT should be considered as part of a general prevention strategy for women at the onset of the menopause. So this was them recommending this many years ago in 2016. It's still not recommended, although we've got good evidence that it does. And actually, Hodis has written a really good paper talking about HRT and reduction of all-cause mortality, so death from all causes, and cardiovascular disease. It's about time and timing it's got. And really this is saying that the younger a women start hormones, the better for their cardiovascular disease risk. And there's a great graph here actually of looking, I don't know how easy it is to see, but you can see the top line. With time, obviously, people will die, so there'll be less people alive. But actually, if you look at people who were not on HRT, so this is a lower line, far more people dying. So people on HRT, less were dying. Of course, people are going to die, whether they take HRT or not. But you'll see this risk reduction was really significant, and that is very important. Now, this was actually, all these studies, when they talk about this 10 years, was looking at women taking older types of HRT. Now, I've talked about HRT before. There's plenty of information on Balance app, and also the balance-menopause.com website, and also in my book. But there is a difference between the synthetic hormones and the natural body identical hormones. So the synthetic hormones were usually the tablet estrogen, which has a small risk of clot, but also the synthetic progestogens. Now, most of the studies was using something called medroxyprogesterone acetate, MPA, which is a synthetic progestogen. We know that women who take the synthetic progestogen, because it doesn't have the same biological effects in the body, actually have an increased risk of cardiovascular disease from taking it, and a small increased risk of clot as well. So it's no surprise that if people are older, they're more likely to have some heart disease, and that's what happened with the WHI study, of course. But if you give somebody something that they've got a bit of heart disease, then you give them something that increases their risk more, then there might be an increased risk. And that's why this incidence of heart disease was more in women over the age of 60 or more than 10 years from their menopause. Now, things have moved on. Of course they have. So now when we think about giving the natural body identical hormones, so the same estrogen as we produce, the good estradiol, which goes through the skin into the blood, keeps as the estradiol, so it's very anti-inflammatory, has all those wonderful effects on the endothelium, on the heart, on the conducting system in our brains, then of course it's still going to be beneficial for older people. Why would it be different? Why would me age 61 compared to me age 59 have different processes for the estradiol? It just doesn't make sense, does it? And the progesterone that we give usually is the natural body identical progesterone, which again is very anti-inflammatory. It's not associated with an increased risk of heart disease. It's not associated with increased blood pressure either. Again, really important that we know that. Now, there haven't been any randomized controlled studies with the natural body identical hormones versus a placebo, and I don't think there ever will be, because most women don't want to take placebo, they want to take their natural hormones. But it does make sense when you look and unpick the evidence and look at basic physiology, how our hormones work in our body. And so it's likely that women who are older actually can still take body identical hormones and start taking them when they're older as well. And certainly in our clinic, we often see older women who have missed out on HRT, and they can usually benefit from taking HRT because the benefits outweigh the risks for most people when it's the natural hormones. And we also know, so some people talk about taking HRT, the lowest dose for the shortest length of time. Now there is a study that shows that when women stop taking HRT, they have an increased risk of a heart attack or stroke in the year after stopping it, because it's almost like a rebound effect. The body's had all this inflammation reduced, the cholesterol lowered, the blood pressure lowered, and then suddenly all that's gone, like the brakes have gone, and the body maybe goes into overdrive, who knows, but there is still an increased risk. So you have to be careful when people are told to stop taking HRT, because for most women, as you know, the benefits do outweigh any risks. There's another study that I was just going to mention to you as well, which actually has come out more recently. So this is in 2020, so we're getting a bit closer. And this is called Menopause and Hormone Replacement Therapy in the 21st Century. And it just reviews the evidence exactly the same as I've said before. There's a nice little picture here and another picture here about the mechanism or the beneficial mechanisms of estrodiol on the heart and the cardiovascular system. And it says the time has arrived to shelve WHI, which is this older study that everyone still talks about, and its limited applicability to the lives of menopausal women. Human identical, which is the same as body identical, transdermal, through the skin, estrogen, and the natural progesterone should be offered to most menopausal women, especially at the time of the menopause. Menopause has a powerful negative impact on cardiovascular health of women. They deserve to be offered hormones using the hormones identical to those produced by the ovaries, and they should be prescribed in the most physiological manner possible, which is what we do in our clinical practice, yet we know globally only about 5% of menopausal women are receiving hormones. In the UK it's about 14%, but not all of those are the natural body identical hormones. So we've got a huge way to go. Women who do have cardiovascular disease or do have raised blood pressure can usually safely take HRT, and the natural hormones often have a blood pressure lowering effect as well. If you do need blood pressure lowering treatment, you can still take that in conjunction with your HRT as well. So although the guidelines, and we know there's some recently from the American Heart Association, say that HRT is not recommended for primary prevention, there isn't actually evidence to say there isn't. I've been trying to look for an article or a publication today showing that body identical hormones increase the risk of heart disease, and I can't find any. So if you do find any, let me have them. But I think some of the saying there's not enough evidence is more of a political thing, because if they said there was enough evidence, then we would have to prescribe HRT a lot more, but women would have to be insured as well, which they don't want to. But we know from the evidence, there's more evidence that taking HRT for primary prevention to reduce the risk of a heart attack, actually the evidence is better than compared to a statin or a blood pressure lowering treatment for women. So we need to look at why HRT isn't being prescribed for us to reduce the risk of cardiovascular disease when heart disease is so common. So I hope that's been helpful. You've been great with giving me questions, but what I tried to do is be a bit more scientific today, because I wanted everyone to think really about our hormones and what they do to us when we're younger, and how they help us keep our bodies healthy and our cardiovascular system healthy. So then you can quickly understand that when you don't have hormones in your body, that can trigger symptoms, so including palpitations, but also increase incidence of heart disease as well. So lots of information. I'm going to put some resources on my story soon so you can learn more about what I've been telling you, and I will put some of this evidence over the next few days as well. So I hope that's been helpful. Next week, because it's close to Valentine's Day, I'm going to be talking about sex and the menopause. Really important topic. So I hope that you can tune in then. I'm going to post this on my grid anyway. If you've got any feedback, any questions, any ideas for future topics, then please put them in the comments below the grid, and enjoy the rest of your evening. So I hope that's been useful for you all and you've all learnt something. So thanks for joining me.